Bismillahirrahmanirrahim. Assalamu alaikum everybody. Today we're going to be talking about the muscle attachments of the femur. We'll start from the head, and here you can see the head of the femur, and we talked about the fact that there's a pit here in the spherical head of the femur, which is known as the Fovea Capitis. This pit or fovea has the attachment of a ligament known as the ligament of the head of the femur or the ligamentum teres. So you can see the cut version here. So this ligament originates from here, the acetabular notch and the transverse acetabular ligament, which is here, and then it is inserted into the fovea capitis, and within it carries a branch of the obturator artery. Now this artery is responsible for supplying the blood to the head of the femur in childhood, but in adults, after the disappearance of the epiphyseal cartilage, this branch of the obturator artery only supplies a very minimal area around the fovea, and most of the blood supply is because of the medial circumflex femoral artery. Okay, so here you can see an anterior view of the femur and the various muscle attachments on it, and a posterior view of the femur. So we'll start from the anterior view here. Now we talked about the head. After that we talked about the neck and the two trochanters. So coming on to the greater trochanter, the greater trochanter has an apex, which you can see here from the posterior aspect of it, and here. So this is the apex. Then it has a lateral surface and a medial surface. Now on the medial surface there is a deep fossa known as the trochanteric fossa, and on the anterior surface you have a rough area on the lateral side of the anterior surface, and also on the lateral surface of the greater trochanter we have an oblique ridge. Now on the apex of the greater trochanter is the insertion of the piriformis muscle, right? And then coming on to the medial surface, just superior to the trochanteric fossa, there is a rough area, and on this rough area is the insertion of the obturator internus muscle as well as the superior and the inferior gemelli. Within the trochanteric fossa is the insertion of the obturator externus muscle. On the anterior surface of the greater trochanter, the rough area on the lateral part, here there is insertion of the gluteus minimus muscle. And then when we move on to the lateral surface, which you can see better over here, there is the insertion of the gluteus medius muscle. Here you can see the lesser trochanter, and on the lesser trochanter is the insertion of the iliopsoas muscle. Here you can see the intertrochanteric line. So this is the anterior view, the greater trochanter and the lesser trochanter, and here you have the intertrochanteric line, and along this intertrochanteric line you have the attachment of the capsule of the hip joint. Along with the capsule on the anterior intertrochanteric line, there is also the attachment of the iliofemoral ligament. Along with the capsule and the iliofemoral ligament, on the upper part of the intertrochanteric line, the uppermost fibers of the vastus lateralis muscle are also taking origin from this part of the intertrochanteric line. And from the lower part of the intertrochanteric line, the uppermost fibers of the vastus medialis muscle also originate. So the posterior view of the femur shows the intertrochanteric crest here. Now in this part here, there is a tubercle known as the quadrate tubercle, and on this quadrate tubercle is the insertion of a muscle known as the quadratus femoris muscle. So we've talked about the upper end of the femur. We've talked about the head, the two trochanters, the intertrochanteric line and the intertrochanteric crest. After that, we move on to the shaft of the femur and the various attachments of muscles on the shaft. So we'll start with the anterior and the lateral surface of the shaft of the femur. A muscle known as the Vastus Intermedius muscle takes origin from the upper 3/4 of the anterior and lateral surfaces. So all of this red here depicts the area from where the Vastus Intermedius muscle originates. So this would be the anterior part, the anterior surface, and then moving on to the lateral surface of the shaft here, and this also shows the lateral surface of the shaft of the femur where the Vastus Intermedius muscle takes its origin from. After the Vastus Intermedius muscle, on the anterior surface of the shaft of the femur, there is the origin of the Articularis genu muscle. Right here, you can see that. Now, this lower about 5 centimeters of the anterior surface are related to the suprapatellar bursa. Right, so coming back to the vastus lateralis muscle, we talked about the fact that it takes its origin from the upper part of the intertrochanteric line here. So the uppermost fibers of the vastus lateralis muscle originate from the upper part of the intertrochanteric line. Now, tracing the origin here, after the upper part of the intertrochanteric line, the origin takes place from the anterior and inferior aspects of the greater trochanter. So this would be the origin of the vastus lateralis muscle, and then following it posteriorly, it goes onto the posterior aspect of the femur here, right? And then this would form, so here we have the gluteal tuberosity, right? And so the vastus lateralis muscle takes its origin from the lateral margin of the gluteal tuberosity here, and then all the way down on the lateral lip of the linea aspera is the origin of the vastus lateralis muscle. After the vastus lateralis muscle, we have the vastus medialis muscle. Now, the vastus medialis muscle again takes its origin. The uppermost fibers originate from the lower part of the intertrochanteric line. Now, following it here, this is the origin of the vastus medialis. Following it here posteriorly, so it takes its origin from the medial lip of the linea aspera all the way down here to the medial supracondylar ridge of the femur. So after that, let's talk about the gluteal tuberosity here. On the gluteal tuberosity is the insertion of the lower fibers of the gluteus maximus muscle. Now, the gluteus maximus muscle is a large part of it is also inserted into the iliotibial tract, but some lower fibers get inserted onto the gluteal tuberosity, which is present about here. Now, inferior and lateral to the lesser trochanter, on the lesser trochanter we have the insertion of the iliopsoas muscle. Inferior and lateral to that, you have the insertion of the pectineus muscle, right? So, after that, we have the adductor longus muscle. Now, the adductor longus muscle is inserted along the medial lip of the linea aspera. So, this here is the insertion of the adductor longus muscle, and it is present between the vastus medialis and the adductor magnus. So, you have the adductor magnus laterally. After the adductor longus, let's talk about the adductor magnus muscle. The adductor magnus is inserted here on the medial margin of the gluteal tuberosity, right? So this is the gluteal tuberosity. So the insertion starts from here on the medial margin of the gluteal tuberosity, right? And then on this one here. this one, and then goes down on the medial lip of the linea aspera. And then there is a hiatus. I'm sorry, I hope I'm showing you the right one. This one here is the adductor magnus muscle, which is lateral to the adductor longus muscle. Once it reaches here, the adductor magnus takes a hiatus. Now, a hiatus is a break, right? So, the hiatus, this part shows the hiatus of the adductor magnus muscle, and then the rest of the insertion of the adductor magnus is here on the adductor tubercle. And the point of this hiatus of the adductor magnus is that the femoral vessels then pass through this hiatus, and once here in the popliteal region, they become the popliteal vessels. And here you can see the insertion of the adductor brevis. Now, on the lateral lip of the linea aspera, between the adductor magnus and the vastus lateralis, so this would be the adductor magnus, and this here is the vastus lateralis. So between these two, you have this here is the origin of the short head of the biceps femoris muscle. So if we start medially, from medial to lateral, first of all, we have the vastus medialis muscle, then we have the adductor longus muscle. Now we're moving laterally. After that, we have the adductor magnus and the adductor brevis muscles. Then you have the origin of the biceps femoris muscle, the origin of, further laterally, you have the origin of the vastus lateralis muscle, right? And here, this part shows the insertion of the gluteus maximus muscle. Along with all of these muscles, the medial and lateral intermuscular septa also take origin from the medial and lateral lips of the linea aspera, along with the medial and lateral supracondylar ridges. So here we will have the medial and lateral supracondylar ridges. So these ridges, along with the medial and lateral lips of the linea aspera, also give attachment to the medial and lateral intermuscular septa. The popliteal surface of the femur is pretty much bare except for a small area here where some of the fibers of the medial head of the gastrocnemius muscle take their origin. Now, the gastrocnemius muscle is a muscle of the calf, and it has two heads, a medial head and a lateral head. So the medial head takes its origin from here, and the lateral head of the gastrocnemius muscle originates from the lateral supracondylar ridge, the lower part of the lateral supracondylar ridge, and just above that is the origin of the plantaris muscle. And this popliteal surface forms the popliteal fossa, which is present at the back of the knee. So just a review of all the muscles on the posterior aspect of the femur. If we start again from medial to the lateral side, you have the vastus medialis muscle, then you have the adductor longus muscle. Lateral to that, you have the adductor magnus, and superiorly you have the adductor brevis muscle. Further laterally, you have the biceps femoris muscle, the short head of the biceps femoris muscle. After that, you have the vastus lateralis muscle. So on the lateral condyle, here you will have the attachment of the fibular collateral ligament of the knee joint, right? And the lateral epicondyle here, which is on the lateral aspect of the lateral condyle, you have the lateral epicondyle, and here is the attachment of the fibular collateral ligament of the knee joint. Now, just beneath that, you have a groove known as the popliteal groove, within which is present the tendon of the popliteus muscle. On the medial condyle, we have a medial epicondyle here, right? So here you have the attachment of the tibial collateral ligament, and on the adductor tubercle, as we talked about before, is the insertion of the adductor magnus muscle. Now on the posterior part of the medial surface of the lateral condyle, so this is the lateral condyle, here would be the medial surface of the lateral condyle. Now in the posterior part of this medial surface, you have the attachment of the anterior cruciate ligament. And in the anterior part of the lateral surface of the medial condyle, so this would be the lateral surface of the medial condyle, in its anterior part you would have the attachment of the posterior cruciate ligament.